that make New Zealanders more grumpy than when they cannot get the medical treatment and the health care that they need when they need it and where they need it. And of course, on the doorsteps of West Auckland, when I go out on a Saturday morning and talk to my constituents, the very first issue that almost always they raise is cost of living. And they are deeply, deeply unhappy with this national-led coalition because at every turn, food, electricity, housing, rates, insurance, almost every item in the household budget has become more expensive under national, even though they promised to fix it. Everything from the car rego to prescriptions is more expensive under national. But close behind the cost of living is the running down and the deterioration, the underfunding and understaffing of our public health system. And I thought the House might like to know about the story of Troy Stewart, a cardiology nurse who recently told The Post that he was so disillusioned with his work as a cardiology nurse at Waitakere Hospital in West Auckland that he has upped sticks and gone to Australia to work, unbelievably leaving his family here in New Zealand and sending money back to support them. He told The Post that at one point on the cardiac ward where he worked, he had to leave an elderly cardiac patient who'd been ringing the bell for more than 10 minutes while he dealt with another patient on the ward that was acutely ill. And Troy said that this was almost a daily occurrence on his ward. Now, Madam Speaker, official documents show that in the last 18 months, more than 70% of the shifts at Waitakere Hospital, my local hospital in West Auckland, were below the agreed safe staffing levels. 70% of the shifts. Now, why is that? It's because Christopher Luxon will not let the hospitals employ the nurses that they need. At the same time, half of our nursing grads are without jobs. There is a crippling shortage of nurses in our hospitals, but half the nursing grads cannot find a job. There's something absolutely mad about that situation. And the people that I represent in West Auckland, they desperately want that to change. I want to also tell the House about an email that I received this week from a local resident, Vijay Farley Naika, who actually wrote to the Health Minister, and he was kind enough to copy me on his email, saying that the reports and lived experience from patients, whānau, frontline staff in our community point to overcrowding, extended waiting times, workforce shortages and uncertainty in clinical decision making, particularly in emergency and acute services. He talked about the fact that his father was misdiagnosed at Waitakere Hospital after prolonged waiting times and a lack of continuity and urgency in his care. His father had other problems at Waitakere Hospital, and Vijay Farley Naika observes that these experiences point to systemic issues rather than individual failings. Staff appear overstretched, decision-making is compromised by workload pressures, and families are left feeling anxious, excluded, and unsure whether their loved ones are receiving the care they need. Madam Speaker, 650,000 people, according to the New Zealand Health Survey, cannot get the care they need. But luckily, Labor has a plan. We will provide a Medicard for every New Zealander that provides free doctors' visits. We will invest in the health system. Labor will make sure that people get the care that they need locally.